A very warm welcome to GMT. The extent of the global pollution problem has been laid bare in a major new study. A scientific paper published in the Lancet Medical Journal found that exposure to man-made chemicals led to the deaths of 9 million people in 2015, mainly via heart disease, strokes and lung cancer. The most severely affected countries include China, Pakistan and India, where pollution led to a quarter of all deaths. But more developed countries are also affected, as Andrew Plant now reports.
Particles in the air built up and breathed in, and pollution in the water that can end up inside our bodies. Exposure to man-made chemicals a factor in 9 million deaths in 2015, says a study, contributing to killer conditions like heart disease, strokes and lung cancer. In this global study, pollution was linked to 1 in every 6 deaths worldwide, and air pollution from our vehicles and factories was by far the biggest killer, linked to more than 6 million deaths around the world in a single year. In some African countries, 25% of deaths were attributed to pollution, like Niger, Chad and Somalia. In India, the figure is also around a quarter, and in China, 20%, 1 in 5 deaths, were linked to pollution. This time-lapse footage shows air pollution in Beijing. Countries which have undergone rapid industrialization had the highest figures. The study in the Lancet involved 40 researchers worldwide, taking a snapshot of global health in 2015.
There are examples. For example, Bangkok has done well in its air pollution. China is also flattening out the impact of air pollution in its own country. There's an awful lot more to do in different areas, but we do know how to solve these problems. They've been done time and time again. It's a matter of bringing those solutions to bear.
Chemicals in the air were the biggest killer. Contaminated water and poor sanitation second, a major cause of infectious disease. The researchers say air pollution is reaching a crisis point worldwide, and say those with existing lung and heart conditions, elderly people and children are being hit the hardest. Andrew Plant, BBC News.
So the numbers are dramatic and alarming too. Let's speak to Vijoleta Gordeljevic. She's Health and Climate Change Coordinator for the Health and Environmental Alliance. That's a not-for-profit organisation based in Brussels. Now, first response I'd like from you is whether these numbers tally with what you see in your research. Are you surprised by these numbers?
Well, thanks very much for having me, Stephen. First of all, no, we're not surprised by these numbers, but as an organization that's been working on pollution and on raising the awareness on the health impacts of pollution for more than a decade now, we are very happy that this report came out at this point, because for 2 main reasons, really. First, as was mentioned briefly, it is the first time that we actually look at all kinds of pollution and their health impacts. So we look at air pollution, water pollution, soil pollution, to some degree also pollution from chemicals and how they impact human health. And the numbers in here, 9 million deaths every year, they show that pollution cannot be treated anymore as a merely environmental issue, but that now we have one of the world's oldest medical journals confirm that it is a serious threat to our health. And the second major reason why I want to mention why this report is groundbreaking in our eyes as well is because that next just to presenting evidence on the health impacts, it also gives us very evidence-driven recommendations that have been proven in other countries and that we know work in fighting all these sorts of all these kinds of pollution. So all governments really have to do at this point is pick them up.
Right. I mean, we know pollution is a global problem, but why is it that in terms of the premature deaths, the numbers are so skewed to the problem being in the developing world, the emerging economies?
Well, of course, the numbers here depends on what kind of pollutions we're looking at. We obviously in Europe have less of a problem with water pollution, so the number of deaths here are very, very low. Air pollution is a major issue in Southeast Asia, especially. We're here looking as well as household air pollution, so indoors, looking at how people have access to cooking stoves, what kind of materials they use to make a fire, to prepare their foods. And indoor air pollution is a big burden in those countries. But even in Europe, we see that more and more cities are struggling with air pollution. Here, the reasons are slightly different. Here, we more look at the transport sector. We look at the kind of cars we drive. We look at fossil fuels still being heavily used to fuel our energy system. So obviously... Yeah.
Yeah, very briefly, do you see signs that governments around the world get it, that they really must act now on pollution?
Well, I mean, if we as a society agree, and I believe we do, that we are committed to protect our health, to protect the health of our children, and we know that we can fight social injustices at the same time through pollution control strategies, then all we really have to do is to start designing, to start planning, and to start implementing those measures that we know this report is giving us. Governments need to take clear leadership here. They need to prioritize pollution. They need to fund pollution control strategies, and they need to make sure that we do more research in that field and we monitor progress. Worldwide, we can say that no, this is not being done sufficiently.
All right, Vijoleta in Brussels, thank you very much for joining us on GMT. And you can find out much more on this story by going to our website, bbc.com/news. We've got details there about this study in the Lancet that we've just been reporting upon. And there's a list of countries with high pollution-related deaths.